All right, Dr. Chong, I'm going to start with you first. Could you please give us a little bit of detail on how the virus is actually transmitted?
Yes, well, in the beginning, we noticed a cluster of pneumonias in Wuhan, China, mainly associated with a wet market that sold live animals. And starting in January, we noticed cases that were not linked directly to the market anymore, and that proportion grew and grew. And that's when we realized there was person-to-person transmission. The main mode of transmission is really by aerosol droplets when we sneeze and cough, and or micro mists, micro sprays when we're talking, just like this. The other is contact transmission. It may be touching of the, say, eyes, nose, mouth, and things like that, as well as what we call fomite transmission, FOMITE, which is a transmission via inanimate objects such as various surfaces or pens and clipboards and towels and things like that, and they become a transfer vehicle when there is infected material on there. As far as distance, and you hear a lot about social distancing, the typical scenario for this type of transmission is about 6 feet, although we know that the mists and microsprays can hang in the air, and that can certainly travel a little bit. So you may hear some groups that recommend about 10 feet as far as distance. And we also notice that in chamber studies that these aerosols and all can remain viable in the air for about 3 hours. So those are things to consider as you kind of set out your risk assessment and plans for the workplace.
Thank you. Dr. Magari, do you have anything to add to that?
No, I think that was really good. I think the important part is really understanding the social distancing is a minimum of 6 feet. The more, the better.
Thank you.